Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode. Excited to have you back. And today I've got an interview for you with Dr. Scott Munsterman of Chiro Armor. And he is all things compliance. And little disclosure, I've been working with his group for my private practice since the summer of 2024. We've taken on the project of clinical compliance, and it's been really good. We've done everything from building out best practice manuals to getting clear on compliance issues and year-end trainings and notes and all the things. I mean, it's really, when you're running a healthcare practice, there is a lot of regulation, as you know, and there's a lot of things that you have to be keeping up with. And it's part of your responsibility to do that and start to learn that process. And so we did finally, we were piecemealing it before, but definitely eye-opening to actually go through training. And it was kind of like not knowing what I didn't know at some points, or sometimes knowing what I knew, but wanted to be in denial about it. And so it was great. It's been great to go through that. And we dive into a lot of the key aspects of what Dr. Scott looks for when working with clinics to give you an idea of some of the things you need to be thinking about in your practice and starting to be be compliant, whether it's with your state or obviously the U.S. federal government. And then, if you're in a different country, which a lot of you are, I know we got quite an audience in Canada and Europe and Australia, which is cool. I love you guys. Look at compliance, how it would relate, obviously, to your country or province, and make sure that you are working towards compliance. All right, without further ado, here is my interview with Dr. Scott Munsterman. All right, welcome to the show. I got Dr. Scott Munsterman on here, and we're going to talk all things compliance and really get you up to speed to at least a certain perspective on what you need to be considering for your chiropractic practice. But before we dive into it, tell us a little bit about yourself, Doc.
Oh, happy to. Thanks for having me, Dr. Kevin. I appreciate
Absolutely.
it. It's an honor. Coming up, let's see here. I graduated from Northwestern in December of 1984. And
Nice.
so coming up on 40 years here, I'd have to do the math. Maybe it's 41. I don't know.
Yeah, you're getting there, 41 by the time this comes out.
Yeah, exactly. Well, and just really loved the career, loved chiropractic, loved what it does for people. And just really kind of found myself through a lot of different phases and chapters of my life, professional life, and just all of that. Was in practice for over 25 years, had a large group practice of 6 DCs and a PT. We practiced in a surgery center that was co-owned with pain management anesthesiologists. So learned a lot about integrative care, how to work with patients with other providers through the meantime. Over the course of time, I served 13 years as an elected official, first on the city council within my community, then a couple of terms as mayor, then a few terms as a state legislator, and chaired a number of committees and was active in the party and leadership within the state. And over the last probably 15 years now, I've been primarily consulting role, working with clients, all chiropractic practices, integrative multidisciplinary practices all across the United States, in helping them with their compliance programs and being a sounding board and helping them in their practice management discussions, business, discussions, all of that. We work also with an electronic health record that is worldwide, that is in hospital and medical clinics, and we found that to be very helpful for especially those multidisciplinary practices. And so really have found myself towards this end of my career. I'm not saying it's the end by no means, but using a lot of the experiences that I'd had both in clinical practice and seeing patients and working in group practice settings and and all that, and then in public policy,
Hmm.
and, more along the lines of just the experience and expertise that I've been grateful to gain over the last 10 to 15 years
Yeah.
in helping other practices. So this is how you found me today,
Yeah.
Dr. Kemp. That's kind of at this phase, at this point in time in my life. And as always, just have felt, am blessed to feel very purposeful,
Mm.
with what I do. So I don't know if that's the answer you were
That
looking, but that's the one you got.
that's the answer, and I'm proud to say I'm one of your happy clients here, and been working with you since I think early summer, and this is of 2024. This comes out in early 2025, but yeah, it's been quite a learning experience for me as well, and someone that's been practicing since '05 and had my own practice. Uh, I was a practice owner since '07 in a partnership, and then my own practice since 2010, and so my practice was 14 years old when I took this head on the compliance side of things, to make sure that we're doing things right. Ultimately, healthcare is definitely tricky. It's not easy being compliant. It's not difficult, but there's a lot to it, and that's something that I've learned. So I want to thank you for that.
Mhm. Two things to that. I mean, I've been around long enough that I knew what it was like before HIPAA.
Yeah,
Yeah.
exactly.
And back then, way back, and of course, this is before the 1990s, it was all about,
Mhm.
confidentiality. I mean, there was just an ethical thing that, you did, and, likewise with other types of regulatory environments and even going way back to those 1990s, I mean, that's where the Office of Inspector General um, first had their look at healthcare and compliance. And it was the University of Pennsylvania that um, had to learn a $25 million lesson
Yeah.
when they were doing billings that weren't accurate to Medicare, and the OIG picked up on it. Well,
Mhm.
and then the OIG looked at that and like, holy cow, we have this whole industry here that is like, the Wild West,
Yeah.
back then. And so all of a sudden, then we began to see some of these changes, regulatory systems get put into play, and they kind of, it wasn't so much that it was all in a concerted, effort, kind of thing, but it was more like, OSHA saw this, and of course, then
Mm.
the High Tech Act came out, and HIPAA, and all of that, and then the OIG rolls out. Here's what we think a compliance program needs to be in healthcare facilities. They published
Yeah.
that way back in 2000, and that's really has not changed, and is for all
Yeah.
healthcare facilities. And so that's you start looking back, on what's transpired. The healthcare environment, to your point, is highly regulated. I
Yeah.
mean, both on a federal level, but then also on a state level. And then we have our state boards,
Mm.
but it's nothing to be fearful of.
Yeah.
It's kind of like the conversations we have with our clients right away. And we typically see them start to relax after about the third visit with
Right.
us.
Yeah. Yeah. Exactly.
Gosh, we got it covered. There are a lot of things, but you know what? You build a system around that, and when you need to do the things you need to do, and you're guided, then you don't have to worry about it, because you're just doing the right things. You have to worry about wondering if you're doing the right thing. And then the second point, too, is that we many times docs don't know what they don't know, you know, and so then they become overwhelmed, and they can react to that, too, in different ways. But so yeah, it is the environment that we're in. I just think back 40 years ago, when I started practice
Yeah.
uh, and opened my own practice and all of that. I mean, what the environment was like then is just night and day difference to what it is today. Some good, and
Yes.
some that are like are more challenging. I'll just put it
Yeah.
that.
My secret hope is that Elon and the Doge also tackles healthcare compliance
There
and
you
gets and gets rid of some of the inefficiencies. But no, on a more serious note, it's like you mentioned docs that might have been practicing since the late '80s, early '90s. It definitely has probably been a frustrating process to keep up with all of the additions of compliance. And again, like you mentioned, federal, state, plus your chiropractic board. If you've gone through it for 40 years, I mean, it is night and day. There's no doubt about it. And then on the other end of the spectrum, you get the young DC coming out that, let's just say they open up their own practice. You got a lot to figure out just to even make that business actually survive. And then trying to understand and go through all the compliance is something that is challenging. And then you get the docs that are in, kind of, I would say maybe my spot of like 20 years of practice, where you're kind of both things. Like things have changed even in 20 years, and you're trying to keep up with that. And every administration there's something new. And one of the things we might as well make mention that I didn't know about until I was working with you was the fact that this past July and now in January, the minimum wage on salaried non-doctor employees. So if you got an office manager that's on hourly pay and they are full time, if they are salaried and full time, there's a minimum on that. Can you explain to that new one that happened in July and then it escalates in January?
So the salary, and there was quite a few different things that occurred this year that came out, and it'll be interesting to see if anything gets rolled back.
Yeah, I think some will.
A different administration, but it set a minimum wage, if you will, for people that are on a salary. Now, within the last couple of months, one of the things that has been brought forward in some refinement of that is that if you do have somebody on a salary that is below what that minimum wage is going to be, then making sure that you do document what their hours are, during the week, and that if they go over those hours, that overtime would be paid. And so there are some dates to that, but it'll be interesting to see coming into January and if there's going to be any refinements of that whole discussion that a small business has to adjust to a lot of these things. I think there are times where things sound really good on the surface, but how the impact is to a small business can be, I won't say devastating, but it can definitely challenge that business into how to continue to do what they're doing. But yeah, there are regulations like that will come forward, and then it's all about, okay, how does this impact me, and what do I need to do, and how do I need to learn more? And then as time goes on, there's challenges to that, and then those change as well. I mean, we had that happen with the Corporate Transparency Act this year, and we're beginning of the year, it's like, we got to have everybody registered. And we even our company waited until June because we thought, okay, this is going to get challenged. And then it seemed to like die away. And we thought, you know what, we're going to have to start telling our clients they're going to need to do this because the fines are really heavy in January, beginning January 1. Well, what was it, a week or a week and a half ago, Supreme Court put an injunction on it, but it was like last minute, and so it is a little maddening where you're like monitoring these things and you're reacting to it. And yet, you've got to kind of move with the times. And that's kind of the world we're living in right now. And
it is
how to keep up on that as a doc who's trying to treat patients. I don't know. I couldn't do it.
Yeah. No.
I would need somebody to help me.
Yeah. Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do this search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. Here's the thing is like when you do think about it, you mentioned it can be devastating to a small business, and it can, and because if you're a small chiropractic practice and you're in network with insurances, not only are you dealing with all the games the insurance companies are playing with reimbursement and trying to keep up with the billing compliance and insurance reimbursement situation, but then yes, you do need to navigate the waters of regular compliance. And if you really do think about it, a lot of the things that we have to abide by with compliance, it actually does hinder your ability to operate to grow your business that other businesses can do, right? Like a dry cleaner business can offer 25% discounts and can offer buy one, get one frees. And like, I mean, you think about all of the businesses out there that use tried and true strategies to grow a low margin business, which we're in, they have a lot of things they can do. And then we can't do many of those things, right? Like you can't even treat your sister-in-law, probably your ex, maybe something like that. Like, what's the cutoff on who you could treat for free? Is it a cousin or something? What is that?
Yeah. Well, couple of things. So I think what you're referring to would be like your professional courtesy
Yeah,
of what you're going to provide. Um, and really as a practice, you can set that policy, but it has to be grew. Like for instance, if you have a dentist friend and you're treating that dentist friend for free,
yeah,
and you're going in and you're paying him for his services, but he's referring you patients, well, that would go against the Stark law,
yeah,
because there is inducement there and there's like a reward system going on. But if you wanted to treat all the dentists in your region for free, you could do that, because it's not in regards to referrals,
yeah.
that you're doing
Just
it for
blanket
referral.
all dentists.
Yeah. But in a professional courtesy situation, you brought up family, you can extend your family as much as you want.
Mhm.
But where the caveat is that, okay, if there's a Medicare federal beneficiary,
Yeah.
um, then you can't give free care to them. But if it's your immediate relative,
Mhm.
I know I'm going to lose everybody on this now, but if it's your immediate relative, you have to give free care to them,
Yep.
Mhm. And so there's just these different rules around,
Mhm.
the point that you're trying to make is that it can be complicated.
Yeah, yeah.
You know,
It
and
can.
they're standing between navigating the Stark law and the anti-kickback law, and then you got Medicare guidelines, and that's why having a policy like professional courtesy as a part of your policy, so that you don't accidentally give free care to somebody or charge somebody, that you shouldn't be, kind of thing.
Yeah.
Anyway,
There
for
is good news. No, no, there is good news, and we will get to that. But what I want to do is transition into some what you call as your hot targets. You're working with a clinic and you're getting started with them. Talk to us a little bit about some of the hot targets you look at right out of the gates.
Oh, yeah, and we developed this list over years, and
Hmm.
and I even added more to it this year because one of the things that we do when we bring on a new client, we have to be, as the consultant or as the one helping the client, we have to really be careful that we don't assume that they come, with a certain level of compliance.
Yeah.
And so, beginning with, how are we doing our billing today? And I always make sure that our clients feel like, okay, if they're doing something wrong, I mean, this is our, you know, come to Jesus moment on everything here. We want to know everything that you're doing today. And then if there is something that's not right, we're going to work on that to fix it. And so our hot target list really are those number of things that are so integral that we need to make sure we're doing right and they're like rise to the surface. So NPIs, and how are we billing for our services? What type of services do we provide? And then from the offshoot of that, in your state, are you capable or able to do that within your scope of practice? Many times we assume that if we saw it or we bring it in or whatever, that, we can just go ahead and use it because somebody in another state is using it. Well, that's not necessarily the case because many state laws are built around if it's taught at a chiropractic college, then it's approved, or depending on your state, language. So understanding the law, your state law and the jurisprudence around that becomes really important. And so when we ask about services, we're like, our radar is up in saying that, okay, that's a common practice. It's taught in universities, or maybe it isn't. And so we call that out. Again, services, then if we have certain services, how are we coding those services? What codes are we using? Are they properly being used? That wraps into our look at CPT code utilization in general, so that we know what's billed, how many times it's being billed, how are evaluation and management codes utilized? Are they being utilized correctly? Does our client understand, that there's two different ways that you can code an exam?
Can you talk about that? 'Cause I know that was something you taught me. I thought it was interesting.
Yeah. So in 2021, there were changes made to the E&M coding definitions. The AMA and Medicare actually put a lot of work into that and rolled that out. And basically the thing that changed is it puts providers, clinicians in control of how they want to go about coding their evaluation management based on two essential criteria. Okay.
Mhm.
The first one is through medical decision making, and there's actually three categories. Number one is based on the problem complexity, your diagnosis complexity. So let's say, for instance, Scott slipped in his garage, fell on his butt, and he strained his back, and he's got, pain going into his leg. So we know just by that clinical picture that, yeah, well, he probably has a radiculopathy, or he's definitely hurt his back, strained it. Could be some complexity involved. That would be an acute, uncomplicated, or acute complicated situation, which would be that diagnosis code is complex. So number one would be the problem complexity and the number of those diagnoses. Number two would be, or the second category would be, in this medical decision-making model or thinking, is how much data did I have to, as a clinician, go through? Did I order any tests? Did I read any tests? Did I interpret any tests that were done outside of my clinic? Do I have a written report on those tests? Did I have to pick up the phone to call Scott's primary care or whoever to talk about his case, or a specialist? That would be the complexity of the data that the clinician has to wrestle with, think about. And this is all done on the same day of the encounter, okay, the same day as the exam. The third category is what is called the table of risk. And that would be, how risky is my procedure that I do? Well, right away, we are a very low risk type of skill or service that we provide. Manipulation, very low risk, very safe in what we do. So right away, that complexity level is low. Well, then it really depends on the complexity of the diagnosis and the complexity of what we did. If we took x-rays, we have a written report for the day, then those two things will drive if that coding should be a 99202, 203, or 204, depending on complexity.
Gotcha.
So that's one way to go about it. And if you, if that's how you're going about it, then your documentation needs to be on that initial visit pretty well laid out with those things in it, so that if it's audited, they can see that, oh, this is a complexity level that's moderate, which 99203 then is fine. The second way to go about it, which is the way that I typically recommend more so in most cases, is time.
Yeah.
And so evaluation management time at that date of the encounter, we're talking about the day that you examine the patient, you can add both the face-to-face time that you spend with the patient for history, for exam, for reported findings if it's done on that day, any counseling you're doing with the patient. If you had to pick up the phone and call somebody about the patient, on that same day, as well as non-face-to-face time. So let's say prior to the patient visit, you went through their file and it took you 2 minutes or 5 minutes. Well, that gets added to that E&M time. Maybe the patient left and still on the same day, you're documenting in your EHR, for that initial visit. That could take 8 to 15 minutes, depending on how complex and all that. All of that is time that can be documented for that visit that would then equate into that evaluation management code, whether it's a 202, 203, 204, and there are time increments ranges for those codes, as we know. So those are the two ways to document your E&M, and typically to help, and you can decide it could be one way for one patient and one way for the other. It's not all or nothing there. It's either or, but it's good for the clinician to figure out, what is really going to be the best option. And then you make sure that you document that time. That total time spent with patient a day for evaluation and management services was 33 minutes.
Gotcha.
And I'll throw out these tidbits as well. It should never be the same number every single time for every single patient. Okay.
Yeah.
When there's audits that go on, one of the first things that is seen is that how can it be 45 minutes for every single patient that we audited?
Yeah.
So we have to really be careful about making sure our documentation is very authentic and is on the mark. If it was 33 minutes, it's 33 minutes, then go to your chart. Oh, that's a 99203. Bam. Stuff.
Perfect.
So anyway, but that,
Yep.
that
No,
meeting-
I like that because that question gets popped up in Facebook groups all the time, or questions about it and things of that nature. And I remember when you told me about it, it was a lot more different options, like you said. And then there's the time one I thought was great because I think a lot of people think it's just literally when they examine the patient, but they don't realize the report of findings, the notes you're doing, if you're going over ice and heat instruction, that type of stuff, ergonomics or whatever. It all is included in there. So thank you for clearing that up. Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. I want to segue a little bit to, I know that like some of the hot targets are essentially like the NPI, the billing, the essentials around the EM codes and everything. What about, I just want to get this off the table too, because there's so many questions about this, the ABN form. I know this is for Medicare. What is that? Who needs to fill it out? What are some of the details around that?
And that is definitely a hot target, Dr.
Yeah.
Cotter. It many times is misunderstood and then used maybe not right or appropriately. The very first thing we do, and when we work with clients, we have them produce their intake form to us. That's what I ask for, and then I can kind of go through, see what they're going. And remind me, I have a story about informed consent too. I want to share on that.
We'll go from ABN to informed consent.
Perfect. So anyway, with ABN form, number one, we always make sure that it's not expired. And so in the lower left-hand corner of the ABN form, you'll be able to see the date, expiration date. It should say 2026. Okay, and that would be the most active one. The ABN form technically and primarily is used for covered services that are not payable because they may be deemed not medically necessary.
Yeah.
So right from the get-go, that's exactly what the ABN form is for. And so for chiropractic, the only thing that's covered is CMT. 98940, 41, 42 are covered services if they are medically necessary, that patient is found to have a medically necessary condition that is going to respond to treatment and improve their functional ability. Okay.
Mm-hmm.
And I'll stop there because we could get into the weeds of, what is the initial visit requirements, and all that stuff. And then when that patient has completed that active treatment, has reached the end of their episode of care, and they've reached their goals, they're released from active treatment. if it is recommended for them to be on maintenance therapy, then they would at that time sign an ABN form, because that covered service then would be not payable.
Yeah.
And according to Medicare, they're not going to pay for that maintenance therapy, even though they recognize it, and then it becomes the patient's responsibility. And so that ABN form is that cutoff point, you know, saying that, okay, this care is not going to be medically necessary. It's for you, maintenance therapy for you. Um, and these covered services will no longer be paid by Medicare, and you'll be responsible. So the ABN form acknowledges to the patient their responsibility financially, and it releases liability from you that, hey, you told the patient, they signed the form, and there it is.
Mhm.
Now, those services will be in that Part D section where you'll say it's, chiropractic manipulative therapy,
Yeah.
at X amount is not covered, because maintenance therapy. Further down in that form, you'll see 3 options: option 1, option 2, option 3. It's very important to understand that that patient is the one that determines what option they want.
Okay.
Okay, so option 1, if they select that, that means that you are going to still file a claim to Medicare, even though it's not going to be payable, all right? Because you're going to put a modifier, GA modifier on it to say that this is maintenance therapy, and Medicare is going to deny it, okay, not
Mm.
pay on it. Then you'll get that back, that EOB back that says that. But then many times a patient will take that and go to their supplemental plan or whatever, who may or may not pay on. But that's what option 1 is that the patient chooses that. You're still sending that to Medicare. Patient is paying you because, it's not
Mhm.
going to be payable. The second option basically says, don't bother sending it to Medicare. I'm responsible. Don't waste your time. I mean, doesn't
Gotcha.
say exactly that,
Mhm.
but that's pretty much what it is. Option 3 basically says that they don't want the care,
Yeah. Gotcha.
which is kind of a moot point, in my opinion, but it's there. So anyway, but it's very important that the patient is the one selecting those options. It's their right to choose that. And then, of course, signature at the bottom, making sure that, that signature is their date, and it's executed appropriate.
Good. So it's, not for if you've got laser therapy and you charge $60 for laser for that patient. They don't need it. The Medicare patient doesn't need an ABN form for the laser therapy because it's a non-covered service, correct?
So that's technically correct.
Yeah.
Okay. But when you're working with that Medicare patient,
Hmm.
Medicare has told us that it's okay to go ahead and put those non-covered services on the ABN form if we want to communicate to the patient what their full responsibility is. You don't have to. You can, but we do recommend that you have a form that does help educate them,
Yeah.
if it's aside from the ABN, because then they know what their full responsibility is, under,
And
under.
that's what we've done because we're certified in active release technique and we do charge for that. And so we've just used the ABN form to educate them on that charge. And so they're aware.
Right. So good. But I wanted to be very clear on the,
Yep.
technically what that ABN form is for,
Yeah.
with the covered, non-payable covered services, but, it's okay. And it's really good to make sure we inform the patient, obviously of what their full responsibility, is financially.
Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years. And that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. When you make a big investment in something, you want to see a return. And we're seeing that return in clinical outcomes and in our investment. And that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately. Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to kinasmedical.com, KINAS medical.com, mention MCM podcast and receive a free Shockwave in practice book with a purchase of a unit. So that's kinasmedical.com, KINAS medical.com, and mention MCM podcast. All right, let's rock our world with the informed consent. What do you got?
So I probably about half dozen times a year, I am out speaking. And what I've found is that whenever we get on the topic of informed consent in the audience that of my colleagues that I'm speaking to, it's really misunderstood in several different ways. Okay. Um, and it's led me into understanding more and even speaking more on patient safety and all that. But that's for another day, topic for another day, another time, maybe. The key thing that we find with informed consent is number one, the form. Does it have everything that it needs to have? Does it cover the risk? Does it cover the benefit? Does it cover that alternatives have been talked to the patient about? Does it cover what happens, that the patient would be at risk if they don't go through with treatment? Is it signed by the patient and is it signed by the doctor? And so these are really key elements that we talk about in informed consent, and that the informed consent, depending on the procedure that you're doing, is really important to build that informed consent around that procedure. So for instance, uh, manipulation, it is a specific procedure that carries risk, it carries benefits, what are alternatives, all of that.
Mhm.
Many of the other especially newer modalities that are out, whether it's laser or, the shock wave, soft wave, or all that, different types of modalities, they carry with them on their own specific types of things that we need to think about. And both from a contraindication perspective and a benefit perspective and all that. And so number one would be the form and understanding what services that you're providing. Really, the next thought is like, okay, what's my informed consent for these services? So that's really important, and make sure that it has the pieces that it needs to have. The second thing, which is just as important, is the process.
Yeah.
Too many times our colleagues, and it's not just our colleague, it is other healthcare professionals, believe that informed consent, if you do it once, then you're done, and you're not. And what's really important is to understand that if there is ever a material change in the patient's condition,
Mhm.
and I'll give you a couple of examples in just a minute. If there's ever a material change in the patient's condition, whether it's maybe a new region, a new diagnosis, maybe an injury that could have, compounded something or aggravated, a previous condition, or maybe there's a change in the type of treatment that you're doing now, a different technique that's different than what they had before, that they were informed of before. Anytime there's a material change, then an informed consent needs to be provided. Okay. And then finally, if you have a patient that is on wellness therapy or is like maybe PRN, they're in, a couple, 3 times a year, kind of ongoing, or is on maintenance therapy, informed consent should be provided on an annual basis for those patients so that they don't ever forget about, and you create that opportunity for them to be able to ask questions about what they're providing. In addition to that informed consent conversation,
Mhm.
what we're finding is really important to do at that time,
Yeah.
especially with your new patients, because they're maybe completely new to chiropractic, or they are certainly completely new to you and what you're doing, your technique, and how you're operating your methodology, is to let them know at informed consent, this is how we do the adjustment, or this is how we do this. This is what your experience is going to be. I'm going to put my hands on you. I'm going to do this, or I'm going to do that, or we're going to use this instrument. But that's the time to really talk about that what their experience is going to be so that they aren't shocked
Mhm.
when something, when you begin treating them and they're like, oh my gosh, they had something else going on in their mind, either from previous experience or something they saw or whatever. So that's a really important part of the informed consent process as you go through that, so that you have that shared decision-making element that goes along with it, because it's really at that point that you can find out from the patient what their preference is.
Yeah.
I mean, you may have a wide variety of techniques, and you may learn right away that Sally is scared to death of a certain type of procedure or diversified move or whatever, but it's okay to use that instrument or use, a light pressure or whatever. So getting that all ironed out in informed consent is really important.
Perfect.
So my story is this: brought on a new client this year, did the normal intake work, give me all your paperwork, your intake, and it was a husband wife team, and got it. And I went through it and I analyzed it and I made notes and all that. And I noticed that there wasn't an informed consent form in the
Mhm.
production that they sent me. And so I had a face-to-face meeting, then well,
Mhm.
with me, and I'm sitting across and I'm going through the forms, and I got through the forms and I said, the only thing I didn't see was informed consent. And the doctor was like, well, yeah, it's right there. And I said, okay, well, maybe I missed it
Yeah.
because, hey, I'm human. So I'm going back through the forms. There's probably 20 pages. And he's like, it's right there, and I said, well, that's your HIPAA authorization form.
Yeah.
And he just turned white as a sheet. And he's like, oh my gosh, I haven't been giving informed consent to my patients
Mhm.
all the time. He thought that was his informed consent form because he didn't,
Yeah.
it was there, it was a form, they signed it, you know, and there's stories, I can tell you all kinds of stories
Mhm.
about, how things can get missed. And so very important, the form
Mhm.
match to your services, make sure the form has those key elements in it, and then the process. And the process, that new patient, any material change in the patient after that, it could be 3 months later, and the patient's in and they have something different, or that ongoing, maintenance therapy. The last story I'll tell you is that right now I'm involved in a program, I won't get into it, but where I've been doing a lot of reviews of case studies in malpractice cases, and the analysis that I just shared this week with that carrier is that uh, whenever there is a gap of care
Mhm.
with a patient, so let's say Scott comes in, we treat him 6 weeks later, he's good to go. 6 months later, he comes back. And it may be for something similar or something different or whatever. What we've learned through our initial review of these case studies is that gap in care many times eludes providers. And maybe even because we've seen Scott before, it was his low back before, it's the same thing and, whatever. Half the time, the doctor evaluated the patient. The other half of the time, the doctor didn't, following a gap in care. There were no informed consents provided, you know, and the doctor missed a material change. And there are some key indicators that should be red flags,
Mhm.
in which we can cover at some point. But the point being is that informed consent is a very important part of patient safety. And there's things that have to occur prior to us knowing we need to give it. And one of those things is recognizing material change in our patient's conditions. And so I just, as a red flag,
Mhm.
when that patient comes back following a gap in care, it could be 2 months, it could be 3 months. You could have released them a month ago and now they're back again. That should be something that clicks in your mind that says, okay, let's take a look.
Yeah.
Let's do another deeper look at this,
Mhm.
because is there something going on that the patient is going to be experiencing adverse event
Yeah.
that could be underway,
Mm.
and yet we're not able to detect that yet, and that we should be aware of that. So anyway, I just wanted to share that
Yeah.
because it's a part of that informed consent process that makes us know that we need to do an informed consent is when we do
Love
it.
it. No, that's good. And I know there's a lot to informed consent, and that kind of really gives us a good understanding of a lot of the forms and all that. I want to segue just a couple quick topics on different aspects of compliance, but obviously HIPAA is a whole beast in itself. But I just want to have you briefly discuss the business associate agreement, who needs to sign that, and what that is, and then we'll kind of go to the third kind of in my mind, and I know there's more to it, but just overall like compliance training and the value importance of that in a business. But let's start with the BAA and we'll go from there.
Yeah, great. So business associate agreements, anytime that we have determined that we have outside entities, these are people that are not our employees, but people who do work for us.
Yep.
For instance, like a biller, outside biller that you're outsourcing to
Mhm.
your EHR company. Okay. Anybody, consultants like
Yep.
myself that are helping with the program may do audit reviews or that type of thing. It's important to have a business associate agreement. And that business associate agreement essentially says that, hey, Scott, you're going to do this work for me, and I'm going to give you the minimum PHI that you need to get your job done that I need you to get done for me.
Mhm.
But you, the business associate, are agreeing to keep that PHI secure, and you're under the same rules that I am, you, the covered entity, um, under HIPAA, because they are. So basically, that agreement is very important that says that, look, I'm going to give you this PHI, Mr. Consultant or billing person or whatever. And you're agreeing to keep that confidential and that you're going to use the same protections to prevent any disclosure or inadvertent access to that PHI. And they're held under HIPAA law, just like you are the covered entity.
Yep.
All right.
Look.
And so that agreement's very important. And if you haven't had an updated agreement since probably, I want to say probably 2015 or 2014, you should have that updated. And then, have that sent and signed by, those folks that you are doing business with. And so, for instance, even like if you're storing like with your EHR could be cloud based, or maybe you're having it backed up on the cloud and you have a server base. These are all considerations that you need to keep in mind. So yeah, thanks for bringing that up because that's another one of those mechanical things that, can go overlooked.
Yeah, absolutely. And there's a ton to HIPAA. We could obviously do a whole other episode on HIPAA alone, but I just wanted to make mention of that. But our audience needs to realize there is a lot of compliance around HIPAA that we know about. And so we've so far talked about a lot of compliance around billing, coding, your documentation, your forms. Then there's the whole compliance around HIPAA you got to consider. And then one of the things we're doing right now in our clinic, as we record this, it's in December of 2024. It won't come out until early 2025, but we're doing our annual training, each of our team members, 3-year program and going through that. Now, is compliance trainings and screenings and things of that nature, is that something that we have to do as a clinic, or is it a nice to do as a clinic? What give us the scoop on all the different monthlies and quarterlies and yearly annual training around this stuff?
Yeah, you bet. So there are annual training requirements federally.
Mhm.
So it's annual training is required for HIPAA, for OSHA, for fraud, waste, and abuse. And then most recently this year, as you know, we had the non-discrimination in healthcare law that came out, which included under sexual discrimination, sexual orientation, and gender identity. And so we created a training, program for that. But those are the 4 annual federally required training that need to be done. Now, from the OSHA side of it, bloodborne pathogen is typically where I'd like to see the focus of the healthcare. And so we build out our annual training more towards bloodborne pathogen and airborne pathogen, as we've had the experience with COVID over the years,
Mhm.
and then building any safety or any other pieces around that. With HIPAA, typically anything new that's come about within the last year gets included in our annual training programs to bring, our clients up to speed and their staff, as well as some of the basic elements. And then fraud, waste, and abuse. typically that's pretty standard, and that's required as practices that are enrolled in Medicare and in other commercial, payer programs.
Mm.
Um, our other training that we do for our clients typically is through what we call micro learning modules. And we've
Yep.
been doing this for over a decade now with our clients. And a couple of years ago, the Department of Justice actually made a comment in one of their publications that micro learning is probably one of the better ways to learn and teach, compliance. And they're just primarily that 2 to 5 minute quickie on here's how you do this or here's how you do that. And we release those couple every month to our clients on very key things that are just basics, and they just help remind staff and providers how to do certain things. So that's another element of kind of helping build knowledge base. Then the third piece is the role based. So if you have a specific role, billing or whatever, that you can, give that individual more knowledge. In the chiropractic industry, as we know, many times we hire people that have not necessarily been in healthcare, but they have a great skill set. They're great people, personality. They're a great fit for our practices, but they don't know the first thing about healthcare, really. And so we have to begin with them. And so we've developed programs that help bring those people up to speed on what it's like being in a healthcare facility. That, hey, we have this thing called HIPAA. We can't talk about certain things. We have professional boundaries. We've got, a number of things that just need to be learned. And so those are on the training side, not necessarily required, but, important to, stay compliant in certain areas of your policy. But the annual required training, HIPAA, OSHA, fraud, waste, and abuse, and non-discrimination healthcare, those four are federally required.
Love it. This has been great information. I just want to, challenge our audience. I know it's not always the most fun and exciting thing to work through and provide leadership to your team and your business. But once you have decided to be a business owner of a healthcare clinic, there are certain things you've signed up for, just like having to do your notes and pay your taxes. You've got to lead your team on compliance, and don't. I think some people feel guilty about like the fact that they know it's like they're not necessarily keeping up with compliance. They're not doing anything about it. It's never too late. It's you put in the effort, you'll get there. It's not going to happen overnight, as I've seen, but we've made quite a strides in the last 6, 7, 8 months. So it's been really good. How can our audience find out more information and the name of your business and how they can reach out to you if they're interested in getting this compliance training going? And that's the thing, just to kind of leave you with this before we do that is, part of leadership is delegating. Part of delegating is finding experts that necessarily you can actually attach them to your business, like I have with you, to essentially become our compliance team and officer. And been peace of mind to get that done. So how can they find out more?
Well, you can just reach out to us, go to our website, chiroarmor.com, and you can, shoot us an email and say, hey, I'm interested in a demo. We even have like calendar links that make it easy for you. You can click on that. You can find a date that works for you, and it automatically creates a Zoom meeting. And typically what happens is that one of our folks on our team will reach out to you right away and, introduce himself or herself, and then, work up to the point where there's a demo. And many times I'm involved with that, not all the time, but many times I am. And then just giving, the doc a good idea of what program that,
Mhm.
they or he or she feels best. And our clients range from those that have been in practice a long time, like myself, to those that are just starting their practices, and so it's just really a wide range. And gosh, we really enjoy what we do.
Yeah, no, you definitely do, and passionate about it. And one of the other things that was nice to work through was a whole employee handbook with all the specifics we wanted to do. And we had a unique scenario of our first employee taking maternity leave. So we even worked through some of that and getting that in there. And then obviously a full compliance training manual and the whole 9 yards. So feeling good about that. And again, thanks for your time today, Doc.
Yeah, thank you.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.